Good afternoon, everyone. Thank you for joining us today. My name is Dan Lamry, and I'm actually welcoming you on behalf of both of our co-hosts today. So first is ASPD, which is the Associated Students of Planning and Development, which is the student organization that represents Master of Urban Planning students here at the Price School. And I'm also a student worker for METRANS, so doing a variety of different tasks under Vicky de Guzman, our Associate Director, including helping plan events like this today. So on behalf of both organizations, I'd like to welcome you to the final installment of the METRANS Spring Seminar Series. And so we're looking forward to the topic today, which I think is especially relevant for planners and practitioners as we think about how COVID-19 is impacting travel behavior. So really looking forward to a good discussion and hopefully some Q&A at the end. So please prepare some questions for our speakers. And I just also want to note that our seminar series will pick back up in the fall. So on September 8th, we have improving shared ride mobility services through bi-criterion pathfinding from Michael Hyland from UCI School of Engineering. And that event is co-hosted by ITE. And then on September 22nd, we have freight volume modeling on major highway links presented by Lucero Nocera, Senior Research Associate, USC Info Lab at the Viterbi School of Engineering. And so both of those events will be at noon, and they will be virtual, but also we're hoping to have an in-person component to it as well. So definitely something there to look forward to in the fall. And one last thing before I pass it off to our speaker, I do want to also do a quick plug for an ASPD event tomorrow for any planning students that are out there that are returning next year and want to be more involved with our organization. We have an information session at 5 o'clock. So you can reach out to me directly if you have any questions about that. And with that, I'm going to pass it off to our speaker, Yougeng. Thank you.
Thank you for having me here today. So my presentation topic is to understanding mobility change in response to COVID-19, a Los Angeles case study. So this work are done by my advisor, Professor John Giuliano, and we are going to study how different population group responds to the COVID-19 and some related policies during the pandemic. So a little background on the COVID-19. As we all know, COVID-19 is a global pandemic, and as of March 24th, 2021, there are more than 124 million cases and 2.74 million deaths in the world. And America is very badly hit by the COVID-19. About 25% of the case and 20% of the deaths happens in the US. And in the early period of this pandemic, without any vaccines, most of people and the governments rely majority on the pharmaceutical interventions to reduce the transmission of COVID-19 virus. So for the people, for the individual, they usually rely on keeping social distancing and wear mask or face covering. And for the government, and they usually close non-essential business and issue the shelter-in-place order or lock the city to ask residents to stay at home. So we also notice disparities of the COVID-19 cases during different population groups. So in Los Angeles counties, we found more than 75% of COVID-19 cases were from the most poorest neighborhoods, and about 58% of the cases are Hispanic, but only a little more than 10% are white people. So we're gonna ask, how does COVID-19 affect people's travel behavior? And do different population groups respond differently to COVID-19? And also the different related policy restrictions on mobility. So our study period is from January 1st, 2020 to August 9th, 2020. So during our study period, we divided to like 4 major stages based on different policy issue times. So on March 19th, the state of California issued a shelter-in-place order to ask people to stay at home. And 2 months later, the LA County began its first phase of business reopening. And in early July, LA County closed bars, indoor restaurants, movie theaters because of the second surge of the COVID-19 cases. So we divide our study period to 4 stages based on this time point here. So in the stage 0 is the before pandemic, which is the first 3 months of 2020. And then the stage 1 is the enforcement of the shelter-in-place order, which is between the shelter-in-place order issued and then the first phase of business reopening. And the stage 2 is business reopening. And then the last stage is the business restriction, which is in the end of our study period. Our data, the mobility data in this study is from a data company called SafeGraph. So this company collects and measures foot traffic patterns to various points of interest like restaurants, theaters, based on the GPS location from apps on mobile phones. So the right graph just shows the spatial density distributions of the SafeGraph points of interest in the US. So there are more than 3.6 million points of interest all across the country. And in Los Angeles County, we collect more than 850,000 devices, which is account like about 8.5% of the total population. And all of this data are anonymous and aggregate at a sensor block group level. So we also collect the demographic and the socioeconomics data from the 5-year American Community Surveys, which is from 2014 to 2018. So we collect the ethnicity data, the income data, and also the education status data from the ACS. And we also control other factors may affect the mobilities during the pandemic, like the access to internet and computer, and then the weather conditions, which include the temperature and the precipitations in this study. And more importantly, in the COVID-19 cases, which is from the Los Angeles Times. So as I noted before, we want to study how different population groups respond to the COVID-19 and the related policies during the pandemic. So at least in this study, we just divide the population in Los Angeles County to different population groups based on the race and the income level. So we divide our population samples to high, middle, and low income based on the quartiles of the median household incomes of each CBGs. And we also divide the neighborhood to white dominate, Hispanic dominate, African American dominate, and other races dominate neighborhoods based on the proportion in each CBG. So in total, we have 12 population groups in this study, from the low-income Hispanic dominated neighborhood to high-income white neighborhood. So the right map just shows the spatial distribution of each population group. So we can see the yellow color represents the high-income white neighborhoods, which is distributed in the suburban areas all along the coast. And for the low-income minority and the middle-income minority neighborhoods, most of them are located in the city center or the most urban centers in Los Angeles counties. So the next step, we just use a regression model called difference in difference, which is used to evaluate the impact of various policies on mobility change among different population groups. So we compare the change in mobility across like 4 different time periods, as we showed before, and the 12 population groups. The base timeline is the stage 0, which is before pandemic stage, and then the base population group is the low-income white group. So we took 2 mobility measurements in this study as response variables. One is the number of CBGs visited by each device, and the second is the proportion of devices that remain at home for the entire days, which means the proportion of people they don't leave their home during the pandemic. So this slide just shows the spatial distribution of the mobilities across the pandemic. So we took the graph for the pre-pandemic in the left, and then the shelter in place in the middle, and the business reopen stage on the right. So the yellow lines here means the travel communications between 2 locations. So you can see in the pre-pandemics, we see most travels, and in the latter 2, in the shelter in place phase and the business reopening phase, we see less travel, less mobilities in the Los Angeles counties. So this slide shows the mobility response by the income level. So the left panel shows the change of number of sensor block visited during the pandemic, and then the right panel shows the share of devices totally at home during the pandemic. So we mark the different income group by different color. The blue is for the high income, the orange is for middle income, and the gray color represent low income population. So in the general mobility change, we can see a very big drop during the mid-March, which is due to the issue of shelter-in-place order. And after that, we see the mobility keep a very low levels until to the mid-April. We see a very gradually rise patterns for the mobilities until to the mid-June. And then we see the mobility didn't change a lot until to the end of our study period. And we see a very similar change mobility patterns for the share of device at home. So we can see a suddenly increase in the mid-March of the share of device at home because of the issue of shelter-in-place order, and we see a gradually decreased patterns from the mid-April to mid-June, and this pattern just keep consistent until to the end of study period. When we look at different income group response to the COVID-19 and how does their mobility change, we can see in the high income group travel less than the other than the middle income and the low income group during the pandemic, especially in the shelter-in-place order phase. Here we see high income people travel less than the middle and the low income population. And we can see the high income, when the business began to reopen, the high income people begin began to travel more and begin to catch up with the pattern of middle income and low income populations. And finally, their mobility catch up with the middle income and the low income population in the mid-June, which is in the business reopening phase. And their mobility didn't change a lot until to the end of the study period, although we have the second business restriction in the stage 3. And very similar patterns here for the share of device at home. We see the high-income people stay at home most in the shelter-in-place phase, but the pattern just reduced, and more high-income people began to go out of home. And finally, when we look at the business reopening phase, we see more high-income people go out of home than the middle-income and the low-income populations. And this slide shows the mobility response to the COVID-19 by different race group. So we use different colors to represent different race group. So here we see a very similar patterns. We see a very dramatically drop of the mobilities in mid-March, which is due to the shelter-in-place order. And we also see the Hispanics is the group who travel most in during the pandemic, and across all the post-pandemic period here, we always see the Hispanics group travel most than other group. And for the share of device at home patterns, we see increase in the mid-March. And we also see the Hispanic is the people who stay less at home, which means they go out of home more often than other three races here. So based on our difference results, we just divide our finding to 3 parts. The first is the response to different policies, and the second is how the mobility change varied across income level, and then the third is how the mobility change varied across different race and ethnicity groups. So when we look at the response to government orders, we see the shelter-in-place is the most effective way to reduce mobility. We can see during the shelter-in-place phase, the general mobility reduced by 41%, and then the proportion of people who stay at home increased by 63%. And then when the LA County began to reopen its business, we can see the general mobility increased by 8%, and then the number of people who stay at home reduced by 12%. And after that, even we have the second business restriction stage, we can always see a steady increase in mobility, and then the second period of restriction seems has no effect at all. And when we look at different income groups' response to COVID-19, we can see in shelter-in-place order, in the shelter-in-place phase, the high income population decreased travel most, and the low income decreased travel less, which is from a lower base. And when the business began to reopen, we see the high income increase travel more, and the low income people increase travel less. And for the different races response to COVID-19, we see the white people is more response to the policies, no matter in the shelter-in-place phase or the business reopen phase. and then the minority people is less response to the shelter-in-place order and both the business reopening phase. And it's interesting to find that the COVID-19 case rates seems only to have effect in the shelter-in-place phase, but not to have any effect after that. So our finding just shows the general mobility, the low income and the minority are less complied to the shelter-in-place order based on the results from the general mobility change during pandemic. So we are wondering if this is because of they go out more often than the high income and the white people because of they need to work in person. So we are going to, so we divide the different trip purpose to like 5 categories to see how different population groups respond to different trip purpose. Are low income and minority people go out more often because they need to commute to work, or they just go out for some recreational or social activities. So in this step, we just divide all trips to 5 categories. 4 of them are discretionary trips, which include shopping, family personal business, social and recreational activity, and medical dental activities. And then the other one is the non-discretionary trips, which is for the work purpose. So this slide just shows the mobility change by work purpose and social recreational activity purpose. So we just select the low income, middle income, and high income in 3 columns, and we use different color for different risk groups. So we first look at the work trips here. We can see the Hispanic, which is the blue line, is always the group travel most during the pandemic. Even we have the shelter-in-place order, we can always see Hispanic is the population group go to work most than the other 3 races group. And this pattern is consistent for the low income and the middle income. When we look at high income, the result is a little mixed. The gap between the between the Hispanics and the other 3 races reduced. So we only see a small difference between these 4 races. And when we look at social recreational activities here, although we also see the Hispanic is the population group who travel most during the pandemic, but when compared to the work trips, we see a smaller difference between all of these 4 races when compared to the work trips here. And when we look at high incomes, we observe a less difference between race groups. So we just see for the low income and the middle income, Hispanic is always the race group who go out more often, no matter it's a work trips or social recreational trips. And when we look at high incomes, we just observe a less difference between the 4 races group we select here. So for these findings for different trade purpose, we also have the 3 different categories findings. One is for the response to government orders. We see in the shelter-in-place phase, the social, recreational, and the shopping trips reduced by 110%, and 94% respectively. And for the work trips, we see the work trips reduced by 100%. And when the business begin to reopen in mid-May, we see the social and recreational and shopping trips increased by 13% and 8%. And the work trips continue to reduce by 7%. And when the business closed again because the second surge of the coronavirus cases, we see the social and recreational and the shopping trips reduced by 12% and 18%, but the work trip increased by 9%. So we can see the different policies have a very different impact on the different trip purpose. So when we look at the different income groups response to the COVID-19 in different trip purpose, we see in the shelter-in-place phase, high-income people decrease travel more for both work and discretionary trips, and then the low-income decrease travel less. And when the business began to reopen, we see the low-income increase travel less for work trips than middle and high income. And high income increase travel more for discretionary trips, and the low income increase travel less. And we see a very similar patterns in the business restriction phase. And for different risk group, we see the white and other races are more responsive to the policy, to the shelter-in-place orders, and Hispanic and African Americans are less responsive to the shelter-in-place order. And then when the business began to open, we see the Hispanic and African American increase travel more for work trips, but white and others are more responsive to discretionary trips rather than work trips. And the same pattern found in the business restriction phase. So to conclude our findings, we think we found the shelter-in-place order was the most effective policies to reduce travel and the mobilities during the pandemic. And also we found the low-income and minority group were more likely to leave home during the pandemic, both for the work trips and the discretionary trips. We assume like two reasons why the low income and the minority go out of home more often. The first reason is the low income and the minority people have less abilities to work from home. So they lack access to internet and digital resource. And most of these low income and minority groups populations work at essential business like grocery stores, or business requires in-person service like restaurants. So that makes they need to commute to work during the pandemic. And also the low income and minority population has less capacity to purchase service like the deliveries and in-home child care. So both reasons make the low-income and minority groups less likely to comply with shelter-in-place orders, and then they still need to commute to work during the pandemic. So we think the policymakers should provide more support to low-income and minority populations in the future. So for our next step, we want to extend the Thai series to capture response after August 2020. And we also want to investigate how holidays will impact on the mobilities and how the winter surge will impact the mobilities. And also, we want to extend our study to consider the implications of reduced mobilities on social interactions. So does this mobility reductions imply reduced data interactions between different socioeconomic groups, or did the COVID-19 reinforce the spatial segmentations? So these two questions are our next steps to continue this study. And that's all about my presentation. I'm open to take any questions. Thank you.
Thank you so much, Yougeng. Really some fascinating findings and some beautiful visualizations. So thank you so much for this. We do have a few questions in the chat, so I can read the questions for you. So the first one is, did you look at time of day differences, peak versus off peak, weekday versus weekend?
So I think we don't look at it because of this data here. The mobility data we got is the daily data. So we are not going to look at the different hours impact on the mobility change. And we did look at the weekend and the weekdays difference during the pandemics. As you can see here, we can see some peak and unpeak points here. So we think the peak points here is the weekdays, and we can always see the recurrent these patterns occurs. So yeah, and we also control, I think we also control the dummy for weekdays and weekend days in our regression models. And we see I think we found the weekdays on weekdays there are usually more mobilities than weekends.
So our next question is, so first, thank you for sharing these important data and analysis. I wonder if you frame this based on occupation status and not just work trips. Could you do this analysis?
Yeah, it's very hard to tell the occupations, especially these data are anomalous and aggregate at the census block groups. So we don't know what's the jobs they have for each device users. So we can only tell where they go. Is they going to an office building, or are they going to a restaurant? So it's very hard to tell if they have a very different job or different occupations. So I think this is a very good point, but due to the data limitation, we cannot to tell the difference of jobs or occupations.
Next one is, did you look at modal differences, driving, transit, walking, and bicycling?
So I think it's a really good questions. So the mobile phone data cannot tell us the different travel modes the device users take. So it can only tell us the location information of each device users, where they go. Are they appear in these sensor block groups, or are they? So there's no way to tell which travel mode they use.
Did you take into account disparities in access to GPS-enabled phones, especially in South LA?
Oh yeah. We look at the different device distributions for each sensor block groups, and I can tell you we don't find any very much difference between like high income neighborhood and low income neighborhoods. And we can see the average representation for each sensor block groups is like 5% to 10%, which means for each sensor block group, we can get a mobile device data from 5% to 10% of the total populations. And we don't find any very significant difference between high income and the low income neighborhood on the white neighborhood, majority neighborhood, or the black majority neighborhoods. So I don't think it will be a problem for this study.
Next question, how confident are you that the data from SafeGraph is representative of LA County or of the various groups you included in the study?
So I think the SafeGraph is the largest data companies which use the device user, the GPS trajectories from the device, mobile device. So there are lots of papers and studies they have used this data to study no matter the mobility change response to COVID-19 or other like how business reopen will affect the mobility and the different issues. So I think and also in the website here, you can see there's a link here. When you log in, you can see they have their cleaning process for the data and how they get the data in their website. So it's all public to all people. So I think based on the previous studies and the data itself, I think it's quite reliable data we can use for the mobility analysis. And as I said here, there are more than 850,000 devices we can get from the LA County, which is almost 8.5% of the total population. So I think it's a pretty big number for such studies when compared to previous study. So I think this data is quite reliable.
Okay, thank you. Our next question, what is the reason behind the difference in responses between different races?
As we show in our conclusions, we think maybe just two reasons why make this different response across different risk groups. One is for the minority, ethnic minority populations, they are more likely to work in essential business like grocery stores or medical facilities. And they are more likely to work in like a business requiring in-person service like restaurants. So that make they more need to commute to work during the pandemic. But for most white people, they have more ability to work from home because most of them are in high income levels. And then the other reason is the minority peoples. We can see most minority peoples are in middle and low income groups. So this economic disadvantage make them has less capacity to purchase some like online shopping or online shopping deliveries. So I think these are the two assumptions we make why the different race and different income groups respond differently to COVID-19 pandemic and also the different policies.
Okay, thank you. And now the final question, are the SafeGraph data including also commercial drivers? Are we sure they are all residents of LA County?
Yeah, I think this is a really good question. Yeah, as I said before, I think they include all, it's very hard to tell the occupations or the jobs of the device users. So from my assumption, I think they include all commercial drivers if they use if they include the device they use. And I think I'm pretty sure they are all residents of LA County. So the reason is the safe graph data will provide the whole CBGs where they reside based on the night where they stay for the nighttime. So for example, if a person stay at a certain sensor block groups during like 8 p.m. to 6 a.m. next days, they will consider this sensor block groups is the whole CBGs they reside. So at the beginning of this study, we just exclude all like device users reside outside of Los Angeles counties. So so all the study samples here with like whole CBGs in LA County.
Question is policy responsiveness the right term when those of lower incomes work in essential services? That is, those groups may accept the policies but can't comply to the level higher income groups can.
Yeah, I think it's like a debate, right? So the state and the government just issued the shelter-in-place orders to ask residents to stay at home to reduce the transmission of the virus among people. But for some minority and low-income groups, they had to work. They had to commute to work, not like their high-income and the white people. They can work from home. So I think this is justice issues, and that's the reason why we want to do this study. We just want to like from our findings, we just want to ask the policymakers and planners to take more care of these disadvantaged populations. So yeah, I think this is conflict between justice and the public health issue. I think the shelter-in-place order is very effective in reducing mobility, and it did a good job at reducing the COVID-19 cases. But we also need to think about the low-income and minor people, since they are less likely to work from home and they need to commute to work. And it will also increase the possibility these low-income and minor people contract with COVID-19. So yeah, I don't know. I think this is just a conflict between public health issue and justice issues.
Okay, thank you. All right, we do have another question now. So what do you think the data will show after August 2020?
Yeah, this is a really good question. So we haven't looked at the data after August 2020, but we can still see something from the graphs here. So you can see in the beginning of the pandemics, we see a big reduction of the mobilities for all populations. And we can see a gradually raise for the mobilities after mid-April. And we also see the consistent, the mobility didn't change a lot after early July. So I'm thinking with even with we have the second surge of COVID-19 cases, I expect to see a slow and gradually increased patterns for the mobilities after August. Based on the mobility patterns we see from these maps, from these graphs here. I just assume to see a slowly increased patterns of mobilities. So it's just my assumption.
All right, great, thank you. With that, I don't see any other questions. If there are any last minute ones, feel free to put them in the chat, but if not, once again, thank you everyone for joining on behalf of both ASPD and METRANS. We really are excited to have you here today. And we're looking forward to picking this back up in the fall. So once again, those dates are September 8th and September 22nd, both at noon. So that's when our seminar series will pick back up in the fall, and hopefully we'll be in person at that point. So we'll see, but yeah, that's it. Thank you so much for joining, and hope to see you then.